Om Shri Sai Ram. Swami has said, Vaidyo Narayano Hari. The doctor is Narayana. He is Hari. He is Hari Hari.
I can continue.
Doctors are the most important class of sevaks. There is indeed a noble calling. These days, due to social media, Google, we get a lot of messages related to health and purporting to be what is good for us. We take them as the truth even without verifying their source or the authenticity. And we are unable to distinguish fact from fiction. Even sometimes we contradict the messages as to what is good and what is not good for our health. So, to dispel all these myths and untruths, we are very fortunate today to have with us a very eminent medical practitioner, Dr. Barooah. For many of us, he does not need an introduction, but however, it is my duty to briefly introduce him to everybody, all of you. So, Dr. Barooah completed his MBBS from Guwahati Medical College, Assam, and he went on to be board certified in internal medicine and cardiology from the United States. Thereafter, he was honorary consultant Chinmaya Mission Hospital from 1996 to 2000. Presently, he is the senior consulting cardiologist with Swami Sri Sathya Sai Institute of Higher Medical Sciences since 2001. He also is, we also have a medical camp in Sai Darshan, which is going for a long time, and Dr. Barooah leads that along with a team of other doctors. So please give a very another warm round of and I would now request him to, please take the podium. And we can also have a Q&A session depending on how you would like to structure it.
Sai Ram, my pranam, lotus feet of my most beloved Bhagavan Sri Sathya Sai Baba. And I like to thank our convener of our Sai Darshan temple, Vinod Gankadaran, for giving me this opportunity to present my discussion before this august body. I'd like to offer my love and blessing for my seniors and love for my brothers and sisters. Sai Ram. Today we have a very peculiar situation in India that we have a disease of the poverty and disease of the affluence. As you know, healthcare expenses are escalating like anything beyond our income level. So I take care of both children and adults in Swami's hospital since 2001. I see a lot of congenital heart disease. I feel very sad what a state of affairs we have. We claim we are going to be the third robust economy in the world. But if you come to my OPD, I'll show you children coming with alcohol fetal syndrome. Because the mothers have had alcohol during the pregnancy. And these children will have a cognitive deficiency. They can never contribute to the nation building. Then we see children with rubella syndrome. That rubella vaccination, if the mother did not get before pregnancy, if she gets a rubella infection, very likely the child will have rubella syndrome. They come with deafness, bilateral cataract, and congenital heart disease. This vaccine cost only 65 rupees. That we cannot afford. And what India government is doing, they're trying to do everything possible for our economy, but lot less we desire for preventive medicine. I come across children in the OPD with cannot hear. Mothers who are on seizure medicine, fits medicine, it can affect their children, unborn children, and they come with what we call tough or blue babies. But if they have the means, it could have been changed before pregnancy, to some other safer medicines. Then pregnant mothers who are diabetic, they can have a chance of having very serious congenital heart disease in the children, and often these children are overweight at the time of birth. The parents are very happy when they see a 3 kg child, newborn, but actually there is a long-term sinister effect on this. Then children, I see between 5 to 15 years of age, if they have acute rheumatic fever, we prescribe one injection, penicillin injection, that costs 12 rupees. They have to take this injection every 3 weeks till their age of 21. But what happens after some time? They stop the medicine, whatever reason, and they come with actual damage to the heart valves. And when they come to us in their 20s or 25 years of age, then they require valve surgery, valve replacement surgery. So this is the situation in India today. I'll tell you just for information, the GDP of the US is highest in the world. They spend 17% of their GDP on healthcare and health services for its people. Even that is not adequate. There is a disparity in healthcare between the rich and the poor in US also. Whereas India's GDP, 1/10 of US, and we spend 4%, and our population is 3 times more than US. So you can imagine a preventive part of the treatment, it falls on all of us, individually, in the families, in the state. There was a recent article, I was a little distracted by the article in Business World. Come down. Not reaching. Not reaching. We'll cut off costing here. It's not reaching. It's samosa that we take. It eats into our GDP. I was wondering how a samosa is connected to GDP. I'll come to that. There are a lot of explanation for that. See, any disease condition to treat, there are 2 parts to it. One is the treatment part, one is the preventive part. After the Second World War, England and UK, they decided to open a national health service. So every British citizen will be healthy one day with injections, capsules and knife. But it did not happen the way they expected. Now they are almost bankrupt today. So there is no end to treating illness by giving injection, pills Now there are injections for high BP now that you can take every 3 months. There are injections for cholesterol. You can take every 3 weeks or every 3 months or every 6 months. But this comes at a price. When drug companies spend billions of dollars, they expect 20% at least profit within the next few years from the public. So people have realized worldwide that this is not the correct approach. To treat them when they are ill, we wait for them. They come with a heart attack, we do angioplasty. They come with a heart attack, we do bypass surgery. That is not the way going to make us healthy. So I am going to basically talk about healthy aging. What is healthy aging? Healthy aging is the most crucial period of our life, everybody's life, between 30 to 75. This is the time we can be very productive, help in nation building, we can achieve our goals and dreams. So we should not have suffer from any of the chronic diseases. So what are the chronic diseases? Diabetes, high BP, cardiovascular disease, heart attack, obesity. There is a big epidemic now in India and worldwide. And COPD or smoking or smoker's lung. Then there is people with some common cancers. Then depression and dementia. So these are the common disease definition of chronic diseases. If it lasts for more than 1 year, CDC defined them as chronic diseases. So how to have a healthy aging? So people are looking at different communities in the world. They found there are communities in China, US, in India. In some villages and communities, people live up to 75, 80 without suffering from diabetes, without suffering from high BP, without suffering from any of these illness. So what is the secret? So that is what the present theme is. They looked at UK Biobank data, Framingham studies in US, and Chinese studies, and in India there is a large study going on in 3 villages of Maharashtra. They found these villages, people live long with what we call it a healthy aging without some of the chronic diseases. So this study is ICMR, Indian Council of Medical Research, and British Heart Foundation, Oxford University, and National Heart Disease and Lung Institute of US, which is funded by US government. And they have collected a lot of data from these 3 villages. There is not many migration of people in these villages. So far they have collected about 2,20,000 people. And their information is amazing. They go to their houses and talk to each of the individual in the family. They want to know how much water they drink, how much sleep they have every day, what food they eat, what food they avoid. And they have taken their hair sample, look at their genetics, they look at their nail sample, where apparently the pesticide will be exposed from the nail sample. And a lot of this information is going to help us. And right now it is one of the largest studies in Asia. They want to include about 3 million people all over India, to include almost every villages of India. If you look at Indian history, we see from very beginning, Krishna in Bhagavad Gita told Arjuna how to do meditation. Keep the spine straight to get the maximum benefit. Then Krishna said to use the upper mind to control the lower mind. We know the upper mind is the intellect. So for those who have conquered the mind, it is their friend. So mind should never be the master, it should be the servant or the friend. Patanjali Yoga Sutra, which is the foundation of classic yoga, we know the benefits of yoga now. There is yoga day all over the world. Then Sushruta, who is the great teacher of Ayurveda, who is the father of plastic surgery, who has also explanation how to maintain a health is a state of equilibrium of tridosal. So it is not new concept in Indian history. In October 4th, 1956, Swami opened the first hospital, the General Hospital in Puttaparthi. And first day, with a big crowd was there, Swami declared, "I will be very happy if this hospital closes down." People were surprised, "You are opening the hospital and you are telling you will close down the hospital." Actually what Swami meant, so there will be no need for this hospital. If everybody is healthy by listening to Swami's messages, there will be no need for this hospital. And subsequently on 30th of March 2006, Swami opened the Sai Mobile Hospital, catering to 1600 villages all around Puttaparthi. And Dr. Narasimhan was the first director of the mobile hospital. And in the interview, Swami asked him what is the definition of health. So he gave as usual definition from WHO. Swami said, no. I will tell you what is the definition of health. So Swami said, ahara. Ahara, Swami does not mean what we eat every day. Swami said all 5 senses are bombarded with information from the outside world. What we see, what we inhale, what we hear, every message are bombarded continuously. And so that, Swami said, to use discrimination, we use not the information that we get into our mind through the ahara. So vihara, Swami said, physical activities. Now we know 70% of the lifestyle diseases are due to lack of exercise. And uchara, anger. See, anger leads to loss of energy for 3 months. Those who have heard about Jean Goodall, biologist and anthropologist, who studied chimpanzees for 30 years in African forests, she wrote, chimpanzees when they fight, after 3 minutes they forget about it. But about us, I don't forget. Do you? So uchara, that is anger, it leads to loss of energy. Vichara, thought processes. So thought processes is very important. Good thought leads to good action. Bad thought leads to bad processes. So ahara and vichara, Swami said, are most important because what we get through the ahara will impact our thought processes, our vichara. So achara, conduct, how we conduct ourselves in the society. And even if you go to metro, I see people fight for a seat. So there are ego classes in the office, in day-to-day life, and there's a lot of mental tension. And what is important is this conduct leading to ego classes not only affects that individual, he carries it or she carries it home and affects the whole family. So Swami has a lot of instruction for having a good health. So Swami said 5 whites, white polished rice. It's okay for children when they're growing stage, they can have a polished rice, but not for adults. Adults should take only unpolished rice. White sugar. Swami says white sugar causes cancer. So how we know this? When the British conquered countries after countries, they introduced sugar to make profit. And they noticed once the sugar is introduced in a community who has never seen sugar, they increase incidence of cancer in those communities, in those countries. White maida. Maida causes increased weight gain, diabetes, and heart attack. And white salt. Salt we need at the same time. It is one of the agents for high BP, especially in low and middle income countries, causing incidence of heart attack, stroke. I will come to that. Then white milk. We always think white milk is good for us. But Swami said no. Excess milk, now we know, the scientists have found that excess milk is related to high prostate cancer. And Dr. Mohan, during the interview, who is the diabetologist from Chennai, and he has written a lot about diabetes and diet. And Swami told him, look at the rice intake and diabetes. So he went back to Chennai, looked at the urban and rural population of Chennai. He looked at different population, those who take 200 grams of white rice, those who take 400 grams of white rice. He noticed that those who take 400 grams from 200 grams, there is an increased incidence of diabetes by 4 times. And this has been proven for large Harvard study that showed if calories from carbohydrate that we eat every day goes up by more than 60%, there is an increased incidence of cardiovascular disease, diabetes, and death. What is the definition of health as per WHO? After listening to Swami's definition, I don't want to know any other definition. So in 46, WHO has said health is a state of complete physical, mental and social well-being, not merely the absence of disease or infirmity. Now if a wicked person is healthy, as per definition, very healthy, but not as per Swami's definition. So healthy aging comes from healthy lifestyle. Key lifestyle factors that leads to healthy aging is balanced diet, regular physical activity, active social engagement, combats loneliness, reduces stress, can improve cognitive function. Cognitive stimulation, we can do at home, learning new skills, new language, puzzles, and reading books, managing stress, and mindfulness in day-to-day activities, and spend more time in the nature. Recently, there was a large study from US. The people who have parks, green parks around their houses, around their communities, they have less heart attack, they live longer. Educate sleep. Sleep for adults, they suggested at least 7 hours of sleep. In 50s and 60s, people in their age of 50s and 60s who sleep less than 6 hours, they are higher incidence of dementia when they get older. And avoiding, of course, smoking and alcohol. Both leads to heart attack and high BP and all the high mortality. WHO declared in 2024, half of the people don't have access to essential health care. Poor health care kills 16 lakh people in India, mostly children. It was reported in Times of India earlier, 2018. So this is the study I was talking about in Parsi, in India. And what they found in 2019, mortality or death per 100,000 population. You see from the heart attack alone in India, among the male, 245 people died during that year in India. During that year out of 100,000. And USA, women 48 per 100,000 died. And looking at the diabetes, there is big disparity. You see India, 35 per 100,000 died from diabetes. USA, 23 died from diabetes per 100,000. This is during the year of 2019. Then among the women, diabetes, India in 31 out of 100,000 died from diabetes and 14 in US. If you add all these chronic diseases, you see India lost 1,097 people, male, out of 100,000 in 2019 from all these chronic diseases. Among the women, 806 ladies have died out of 100,000 from the chronic diseases. In 2022, American Heart Association, in consultation with several societies in the world, they have come up with that cardiovascular health depends on life's essential, all these are modifiable factors. Especially these are valid for Indians, since we don't have any support from any other sources except on our own. So these are very simple modifiable factors. These are health behaviors. Diet, we know what is a good diet. We know fast food is cheaper, we go for fast food, but that is not good for us. We like to eat more French fry, more chips, rather than boiled potato. Our traditional food was very high in residue, high in protein. A sambar, 1 cup of sambar has more protein, more vegetable, more nutrition, more high fiber than whatever fast food you get in McDonald's or any other restaurant. Physical activity. There is a direct correlation with physical activity, which was earlier before British came. We were very active physically, but they told us, no, best way to work is a blue collar job. You sit in the bench, sit in a chair, you do your work. Walking is not good for you. So nicotine exposure. This is exposure to cigarette smoking. This second-hand smoking it carries 7,000 chemicals that can cause cancer in non-smokers, lung cancer, various cancers, including breast cancer, much more non-smokers. Sleep health. Again, as I said, at least 7 hours of sleep for adult is a necessity. Health factors, body weight, it can be body mass index, BMI, as you all know, but it is slowly we are replacing BMI with a waist-height ratio. Suppose my waist is 36 inches, my height is 72 inches, so it's a ratio is 0.5. That is the ideal ratio, rather than using BMI. I will come to that, why I say that. Then blood glucose. This is again on our hand, how we control blood glucose. Then non-HDL cholesterol. When you do lipid profile, you see there is a non-HDL cholesterol. It is much more valuable than learning about total cholesterol or LDL cholesterol. And of course, blood pressure. So we need to follow these modifiable factors very early in life and throughout life. In 60s and 70s also, it is not too late to follow this principle. So who classification with BMI has been discarded in British Heart Foundation and NICE, National Institute of Health and Care in the UK. Now they are using waist to height ratio, which is more accurately describe the risk factor for diabetes, high BP, and all the high mortality. Global Obesity Observatory 22 data reveal 50% of adults in India engage in insufficient physical activity. India's obesity burden will swell to $81 billion per year by 2030. Situation is alarming among women, with approximately 60% of the women in India failing to meet recommended daily activity level. This sedentary lifestyle, coupled with poor dietary habits, is fueling the rise in obesity, what the experts say. It came in Times of India in February 26, 2025. A large Chinese study, they looked at communities where people live long, and they found these life essential 8 factors are very prevalent, and they have a cardiovascular free, chronic disease free life between 30 to 80 years without having BP, without having diabetes, without smoking. So it added, if we follow these life essential 8 factors, it added 45.5 years of cardiovascular disease free life. That is what we want. But this should be done as early as possible and throughout the life course. What is the relation between the step count? You see nowadays all Android phones or even watches, it tells you how many steps you do every day. So this is a large study from Sweden, and it's a small population. It's very easy to follow everyone. And they saw that even 2,600 steps per day can improve your lifespan and reduces cardiovascular diseases. As we increase our steps count to 8,000, there is a mortality benefit, death benefit. So additional benefit, mortality benefit can be found even moderate to high step count going beyond 10,000. But somebody is 70, I would not recommend to go to 8,000, 10,000 steps, because you may have arthritis of the hips and knees, which may aggravate. There are other exercises for people who cannot walk. They can use the swimming and exercise in the water, or they can sit on the chair and do exercise, the muscle strengthening exercise at home itself. So what is the effect of exercise on death? So this is a Canadian study of 17,000 people. And what is compared, people who don't do any activity, they sit around the house all day, and people who don't sit at all, they work very active all day. There's a 54% increase in cardiovascular mortality among the adults sitting almost all the time versus sitting none of the time. So diabetes, now here in 23, India was declared the diabetic capital of the world. Now we have beaten Chinese. It's the only place where we can beat them. So it's very interesting data observed in the British Biobank that people who are diagnosed with diabetes today, even 30 years before, they already have a higher incidence of heart attack, stroke. So this is the upper one curve. That is the line that shows, suppose I get diabetes today. If you look at my past record last 30 years, you see already I have increased incidence of cardiovascular disease, heart attack, stroke. Whereas compared to the general population, who are not diagnosed with diabetes at that point. So it is, I come across people, especially, I'm sorry to say, Sai devotees. I control my diet, I control my sugar with diet. I don't want medicines. That's a very common statement I hear last 20 years, 24 years in some hospital. Come across a lot of people who don't want to take medicine for diabetes. They think it can be controlled with diet and exercise. That is fine, but this is the reality that we have to accept. What is the relation with diabetes and smoking? There are 89 studies all over the world. They demonstrated that active smoking associated with 50% increased risk of total mortality and cardiovascular event in people with diabetics. So diabetics should never at all smoke at all. I'm not talking about others should smoke. Smoking remains a major public health threat globally. Therefore, smoking cessation remains a major treatment target for diabetic patients. This came in circulation study in 2016. ICMR, Indian Council of Medical Research, there are 23 data showed India has 101 million diabetics. What is diabetes? Fasting sugar is more than 126. And pre-diabetes, fasting sugar 100 to 125. And we have 101 million diabetics in 23, and further to 136 million pre-diabetics. And more than 60% will become diabetic in the next 5 years. And first position goes to Goa. They have the highest incidence of diabetics per 100,000 population. Next goes to Puducherry. Third goes to Kerala. Lowest number of diabetics in 100,000 people is UP. What is the relation with hypertension and diabetes? There is a very good correlation. If you have hypertension, very likely you have pre-diabetes and going to have diabetes. And hypertension is twice as frequent in patients with diabetes compared with those who do not have diabetes. Patients with hypertension, high BP, are greater risk of diabetes. 50% of patients with high BP are already pre-diabetic, insulin resistant. Interestingly, women with diabetes have greater incidence of high BP than men. And many patients with diabetes with high BP, it's a very difficult form of high BP to treat. It's called resistant form of hypertension. This came in a Journal of Hypertension study in October 21. Can we do anything about high BP? Suppose I am 20 kilo overweight and I have high BP. If I lose 20 kilo, my BP will come down by 20 millimeter mercury. So 1 kg weight loss will lower BP by 1 millimeter mercury. Aerobic exercise, walking, jogging, cycling, swimming, dancing lowers BP by 5 to 8 millimeter mercury. DASH diet, I'll come to that. DASH means dietary approach to stop hypertension, lowers BP by 5 to 6 millimeter mercury. Smoking raises BP, alcohol raises BP. Healthy diet rich in whole grains, fruits, low fat milk, low salt, BP can go down by 11 millimeter mercury. It's a very interesting study, field study from Brazil. I believe Brazil, everyone has an Android phone, and they communicate with their physician through the cell phone. So it was a nice situation. So what they did in field study, they tried to see the effect of spirituality on high BP. So they have a control group of people who were not given any spiritual message. So on the WhatsApp group, they sent focus on spirituality, gratitude, promotes reflection, forgiveness, optimism, writing messages of gratitude, and videos were sent every morning on forgiveness, optimism, gratitude. After 12 weeks of daily message, just 12 weeks, the BP has come down, average of 7.6. This was recorded in Global Heart 2025. Now they are planning to expand this study. Why to treat high BP? This is always a problem when I sit in the OPD. People ask why. I have no complaint. You are telling my BP 150, 100, but I have absolutely no complaint. I am fine. Why you want to treat my BP? So this is an all-heart trial, anti-hypertensive and lipid-lowering treatment to prevent heart attack, done by the National Heart, Lung and Blood Institute. As you know, this is funded by American government. So I have not quoted any article sponsored by drug companies. All my studies I have quoted either British government, or by US government, or by Indian government. So out of 33,000 participants, 55 years or older with high BP, when they followed for 4 to 8 years, some of them actually gone up to 12 years, treatment of high BP reduces the risk of stroke 35 to 40%. Heart attack incidence came down by 15 to 25%. And heart failure, when you say people have fluid in the lung from high BP, so that is the heart failure reduced by 64%. There is another study, again funded by US government. They compared people with high BP between 130 and 180. They had no diabetes, and they were followed for almost 3 to 5 years. And they found they have two groups of people. One group, they reduces the systolic blood pressure to below 120. And the other group, they try to reduce the BP 140 millimeter mercury. So what they found, after just 3 to 5 years study, 38% lower relative risk of heart failure, 43% lower relative risk of death from cardiovascular disease among the intensive treatment group. Those whose systolic blood pressure has come down to 120. So I am not saying everybody should have a BP 120. There are a lot of people they cannot tolerate. Then of course we cannot bring it down. Present recommendation is BP should be 130/80 average adult. There are insurance data from US from the year 1909 for next 100 years. That time there was no treatment for hypertension. They saw as the systolic blood pressure goes up above 115, the risk of stroke and death goes up. Evidence shows that controlling high BP reduces risk of stroke, heart disease, end-stage kidney disease, the dialysis, peripheral vascular disease, and associated costs. WHO estimated in 2005 that India lost $9 billion in national income from premature death due to heart disease, stroke, and diabetes. In Britain, when they compared the migrants from India, Pakistan, and Bangladesh, there is a 40 to 60% excess death, similar age group of people, those who live in London or Birmingham. So what is that we have that we are increased risk? So US government wanted to find out if a statin is useful or not. So the US Preventive Service Task Force were assigned this responsibility to what is ideal for the American people. I am sure this is also applicable to us. So they found that in 2019, coronary heart disease, most especially heart attack, single leading cause of death and accounted for almost half, 43% of death attributed to cardiovascular disease in USA 2019. A man experienced cardiovascular events much earlier compared to women, and higher overall prevalence of and mortality from cardiovascular disease. So this task force recommended statin use for prevention of cardiovascular events and all-cause mortality in all adults above 40 to 75. If your LDL cholesterol is more than 190, then there is no age limit. Anytime you see a LDL cholesterol more than 190, we have to treat them. Mr. Fit, the multiple risk factor intervention trial. Again, this is funded by National Heart Lung Blood Institute of USA. This is a very nice comparison that we often say, okay, I have low cholesterol, I don't need treatment, but the 3 lakh men followed up for almost 12 to 15 years. They noted that when a combination of risk factors, like people who smoke, people who have high cholesterol, more than 180, those who have high systolic BP, their mortality 20 times more than people who don't smoke, cholesterol less than 180, and systolic blood pressure is controlled. So I think this is enough evidence that this combination of risk factors, it adds up to our cardiovascular disease and mortality. Then this is called inter-heart study. This is a study in 52 countries of the world, including India and China. And the lead author, Professor Salim Yusuf, he was an MBBS from St. John Medical College. He was a medical statistician in Oxford University. Now he is settled in Toronto University. So he has spearheaded this article, this study all over the world in 52 countries. So what they were looking at, a 50-year-old patient in India, 50-year-old person, male or female, had a heart attack. They looked at another 50-year-old in the same community. Why he did not get heart attack? Why this man got heart attack? So like that, they compared 15,152 cases with first attack of heart attack, first incidence of heart attack in 52 countries. They're comparing 14,820 control cases. So they did not have heart attack. They are same age, same sex, same communities. So they found out why they developed heart attack in this group compared to the other group. There are 9 risk factors. These are all modifiable. They can account for 90% of the heart attack in men, 94% of the heart attack in women. So what are the risk factors? Smoking. And we all know it is harmful. It increases heart attack, stroke, peripheral gangrene, and ApoB-ApoA ratio, 3.25. Next time you do a lipid profile, please ask them to do a ApoB-ApoA ratio. Ideally, it should be 0.9 or less. So these studies they found the ApoB-ApoA ratio was very high, 3.25 among those who have heart attack. And they have high BP and diabetes and abdominal obesity. I'll come to that, what is abdominal obesity. And psychosocial factors. It's often that these people are not belong to any church, temple, or any groups, or any clubs. They're often low socioeconomic background. They're often isolated and depressed. So regular physical activity, lack of daily consumption of fruits and vegetables is one of the strongest risk factors between those who had a heart attack who did not have a heart attack. And of course, alcohol consumption, surprisingly, small doses of alcohol consumption, actually they benefited. So similar to this, there was another study done in 32 countries, inter-stroke study. Stroke means the brain stroke, those who get paralyzed. So there are 2 kinds of stroke, you know. One is where they develop bleeding in the brain. They have a very worse prognosis compared to somebody who had a damage to the brain without any bleeding. They have a much better prognosis. So when they looked at their risk factors, why same community, one developed intracerebral hemorrhage, other did not develop. So they found that these people drink more often and they are high BP, smoking, waist to hip ratio is much more. The diet was a significant risk factor. And they also found that carbonated beverages, soft drinks, sugary sweetened beverages leads to increased incidence of stroke. So this cardiovascular disease epidemic in Indians is characterized by higher relative risk burden. What does it mean? We have high BP, diabetes, obesity, smoke, so that is a higher relative risk burden. And earlier age of onset compared to Europe and US, we develop heart attack, stroke, peripheral gangrene, kidney failure, much younger age. And worst is, we have a higher mortality on our first incidence of heart attack. Why Indians? This is a study done by ICMR, Indian Council of Medical Research. why we are prone to have earlier heart attack, earlier stroke, earlier gangrene, earlier kidney failure. So they looked at pregnancies and newborn babies in 5 places in India, New Delhi, Pune, Mysore and Vellore. They looked at birth records. The very interesting finding they came across. The birth size of the newborn baby is related to the total cholesterol in mothers 18th and 28 weeks of pregnancy. And if they have higher blood sugar in the mother at 28 weeks of pregnancy, and the combination of high folate level in the mother and low vitamin B12 level at the 18 weeks of pregnancy associated with a pre-diabetes in 6-year-old child. So they compared these children from London, from those migrants, Indian families, those children who were born in London. They found there was a big discrepancy. They don't have these risk factors. The Indian children have more insulin resistance, born in India, higher level of fasting glucose. If our fasting glucose in a 1-year-old child, 90, an Indian child born in London with a fasting sugar of 70. Already they started showing up, compared with Indian children born in London for Indian parents. So a study concluded that thinness in infancy means first year, followed by accelerated gain in body mass in early childhood, that is up to 6 years, resulted in increased risk of pre-diabetes and diabetes in Indians later on. What about tea and coffee? Often I get this question in the OPD. Tea is better, doctor, or coffee is better? I was always puzzled to find out till I came across this study 2 years earlier, that if you drink 5 or more cups of coffee, you're more likely to have higher odds of stroke. Whereas if you drink tea, green tea or black tea, you have lower odds of stroke. What is the sodium in the diet and the mortality and cardiovascular disease? This is again a study from the interstroke study worldwide. They found 4 out of every 5 deaths attributed to excess sodium intake occurs in low to middle income countries. The average global sodium consumption in low to middle income countries is 4 grams per day. WHO recommends salt should not be more than 2 grams a day. However, I'll come to that. This is March. I did a study from Hyderabad among the IT employees, information technology employees. They looked at their lipid profile, they looked at their ultrasound, they found they have more liver fat. In 84% of the IT employees, they have more liver fat. And this is a precursor for early heart attack, early stroke, and early death. So there are 2 types of obesity. That is on the abdominal muscle. That is not much bothers us. But the fat goes inside, in the liver, in the intestine, in the kidney. Too much, that is called visceral fat, leads to diabetes, heart disease, stroke. Why it happens in Indians? Partly explained by the genetics. Poor diet with high intake of fatty food, increased amounts of carbohydrates, and stress level, inactive lifestyle. So this is a very interesting study by ICMR, Indian Council of Medical Research. In June 23, they published, looking at the obesity prevalent in India, that 39.5% of the abdominal obesity, which is on the left side, called APOC, they are more at risk for heart attack, more at risk for diabetes, more at risk for stroke. Whereas one on the right side, which is a peer shape, 28.6% are overall obesity. So they are not at risk like the other group for risk of heart attack, stroke. They are more at risk of arthritis of the knees and hips, and often they have varicose vein or cellulitis of the leg. So I want to be, if I have a choice, I want to be in the peer shape group. But unfortunately it is not in my control. So this is also a new term you may hear when you come across doctors with your laboratory profile. This is called metabolic syndrome. It's a combination of factors. If there's central obesity that we just discussed, abdominal obesity, if the Men have a 40-inch belly, women have a more than 35-inch belly, and high triglyceride level more than 150, or on medications for triglyceride, or if they have low HDL cholesterol, less than 40 in male, less than 50 in female, they have high blood pressure more than 130 or more than 85, and fasting glucose more than 100, that is pre-diabetes, they often are at risk of higher risk of obesity, higher risk of cardiovascular death. So that's diet. This is the diet going on, study going on for last almost 50 years, sponsored by the US government to find out what is the right amount of salt for American people. So this is equally valid for all of us. So standard DASH diet, dietary approach to stop hypertension. They found that initially they recommended 2300 milligram of salt, which comes to about 1 teaspoon of salt in 24 hours per head. But now lately they have changed that guideline to restrict to sodium to 1500 milligram, that is about 2/3 of a spoon of salt per member of the family per day. So this is a DASH eating plan. DASH eating plan. You can go into Google and find out DASH eating plan, which is the vegetables, more fruits, more whole grain, fat-free or low-fat dairy, fish, poultry, beans, nuts and seeds, and vegetable oil. Now, what is the reduction cholesterol and statin? This is a large study from Europe and USA. They looked at 170,000 people. When they reduced the LDL cholesterol by 40 milligram, say average 38.7, so around 1 millivolt, the incidence of heart attack, heart disease, death, coronary vascularization, angioplasty, and bypass surgery came down by almost, it is a 2:1 ratio. Now this is regardless of the cholesterol level. They were given a statin drug to lower their cholesterol, and there is a 1:2 relation. So 40 milligram LDL comes down with a 20% reduction of all this mortality, cardiovascular disease. So west of Scotland coronary prevention study. You know, one is the prime area in Europe, west of Scotland. They have extensive incidence, very high incidence of heart attack, for whatever reason. So what they did in the study, they gave them, one group they gave only placebo, that means no medicine. Another group, they gave statin, mostly atorvastatin, for five years. And most of these are middle-aged men, above 50, without a history of heart attack, angina. And they followed for 10 years. So after 5 years, they stopped their statin. And they found, even then, there is 18% reduction in all-cause death among the people who received the statin compared to the control group. Jupiter trial is another international study. Again, there was some question, why to treat normal cholesterol level? So this is the study looking at the treatment of normal cholesterol level, normal LDL level. All LDL levels are below 130. So why to treat? Normally none of the guidelines say we should treat LDL level below 130. But the Jupiter trial, it's an international trial all over the world. And what they did, they give them rosuvastatin 20 milligrams. None of these people have heart attack, stroke, angina. But only criteria was their CRP, high sensitivity, CRP level is more than 2 milligrams or above. And after just about 2 to 3 years, among the healthy male and female, half of all heart attack, strokes occur among apparently healthy men and women with normal level of LDL cholesterol. So that was the purpose of this study. Even that normal level of LDL cholesterol is worth treating them if they are at risk. Now aspirin, I know a lot of people may be on aspirin for no apparent reason. So this is the recommendation from American College of Cardiology and again US Preventive Task Force. They say recommendation of aspirin, no for primary prevention. What is primary prevention? You never had angina, you never had heart attack, you never had a stroke, why do you give aspirin? So they said above 60, do not give aspirin unless they have a heart attack, unless they have a stroke, unless they have peripheral gangrene, because the bleeding risk is much more than whatever benefit we get. Now I'll change my gear. You see in Bangalore, last 20 years I see so many orthopedic bone hospitals are coming up. Why? They said it's an epidemic of osteoporosis among Indians. Our vitamin D3 levels are low, 80% of the Indians. So people should stop smoking, no alcohol, regular weight bearing and strength training activities, adults between the age of 19 to 64, to at least 2 hours to 30 minutes of intense, moderately intensity aerobic activities per week, such as cycling, fast walking weekly, weight bearing exercises, resistance exercises are important to improve bone density, prevent osteoporosis. And those who cannot do all this exercise, if you have a two-story house, we can go up and down the steps holding onto the side room. That will be a muscle strengthening exercise. Plenty of sunlight. Why sunlight? It triggers production of vitamin D in the skin that helps body to absorb calcium. So instead of taking shell cal like most of us, calcium-rich food, including general healthy diet, fresh fruits, dried fruits, tofu, the very good vegetable protein, low-fat milk, cheese, yogurt, vegetables, and whole grains. Adults need about 700 milligrams of calcium daily. That can come through only balanced diet. Of course, now this is an older study. Now we have millet. We in Karnataka make maximum millet in whole India, and one of the best vegetable protein. I believe in South America during the times of war, the army soldiers were given millet because such a high protein diet before they fight the war. Cancer screening remains the most powerful weapon against cancer. Regular screening like pap smear for women above 40 and PSA test for prostate cancer among male above 50, oral health checkup with your dentist, and breast self-exam, mostly after the monthly period. And vaccination, especially in India, to healthcare workers, must take hepatitis B vaccine. And quitting smoking and use of tobacco and healthy lifestyle will go a long way to prevent cancer screening. This was a Harvard study on diet and cancer for 30 years. They looked at all the nurses in US and the alumni from Harvard University. They found that those who take alcohol, processed meat, red meat, there's an increased incidence of colorectal cancer. As you know, compared to India, it's about 10 times higher colorectal cancer in US population. So higher ultra-processed food consumption. Trans fat. It's very tasty when you have trans fat in the diet, in the food. High salt, sugary beverages interferes with your healthy aging, reduces cognitive function, reduces physical mental function. So WHO declared that processed meat is a carcinogen for human being. This is a very interesting mission. I know it is inevitable for all of us, but the journey on the path to this can be pleasant. Doesn't have to be miserable. And this is in our hand, that we discussed earlier, life essential 8 factors. Do you know anybody? This is a cremation in Puttaparthi. Mahasiva Yogi. In April of 2005, he had an ashram in Delhi. He brought some close devotees to Puttaparthi and told them, it is time for me to go. Because 6 years later, it was in 2005. The 6 years later, Swami Sai Baba is going to leave his body. He was the first one to announce that. So you can imagine. And he was cremated in Puttaparthi, near Sitapati River, in 2005 April. And exactly 6 years later, Swami left us, as you all know. Thank you all. Sai Ram. If you have any question, please.
Slide number 23. You should take statin.
Slide number 20.
22 reduce CVD.
Statin.
What is statin?
22.
23.
What is the question?
Statin, sir. What is statin?
Oh, statin.
What is statin?
No, they have recommended statin use for prevention of cardiovascular disease and all-cause mortality in adults between the 40 to 75 years of age.
This question is what is statin?
How is statin? That you may be knowing, this is called atorvastatin. Mostly nowadays we are using atorvastatin, and those who are not controlled with atorvastatin, we go to rosuvastatin. It's supposed to bring the cholesterol level down and also what we call pacifies. See, when you get a heart attack, what happens? There are vulnerable plaque, there are ruptures of the cholesterol plaque in the coronary artery, in the rockturnally of the heart. So this, when you give statin or atorvastatin or rosuvastatin, it pacifies, so it prevents the rupture of the plaque in the coronary arteries. So even before any narrowing of the artery or bleeding occurs in the coronary artery, in 6 weeks' time, there is less incidence of heart attack. Those who received atorvastatin or rosuvastatin, depending on the vulnerable plaque. Nowadays, of course, you have CT scan. We don't need to do imaging studies in the cath lab. CT coronary has revolutionized. In UK now, somebody coming with chest pain, first thing they do is CT coronary angiogram, because it saves money for them. Because if it is normal, they're sent home. If they find these risk factors for heart attack, like vulnerable plaque, and they have stenosis or blockage, then they're admitted for an angiogram or angioplasty.
Doctor, can you please tell us what is this APOP and APOA?
APOP and APOA.
OD, APOP, APOD.
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 What is APOD? You mentioned that?
No. My friend is asking.
What is APOD? I don't know when I mentioned. Oh, AP. This is a very interesting actually. Nowadays they are recommending.
26.
Yeah, so they are recommending ApoB and ApoA ratio. So ideally it should be 0.9 or less. So more than looking at the cholesterol or LDL level or triglyceride level, so those who have ApoB and ApoA ratio more than 3.25 among these first-time heart attacks victims. So nowadays we ask them, when you do lipid profile, please ask the lab to do a ApoB, ApoA ratio, because that's much more reliable.
It's a test, doctor.
Sorry?
Is it a test?
Is it a
It's
test?
a blood test.
It's a blood test.
Blood test. Because that's a much more reliable than just looking at the cholesterol or LDL cholesterol.
What oils?
What oils you recommend?
What oil is
What oil you are cooking with? So there was a diet chart, right?
Yeah.
That actually we have not spent much time. I think it was food chart dash.
Yeah, that's right.
dash?
Thirty-seven.
37.
This is
Yeah. So this is the recommendation from Dietary Approach to Stop Hypertension, the US organization sponsored by American government. So they have recommended vegetable oils mostly. So what are the oils you are asking?
Yes.
Yeah. The peanut oil, canola oil, They recommend, of course, because all Europe and US, they recommend olive oil.
Olive oil.
It's a little expensive for all of us, but that's supposed to be very beneficial.
Doctor, can we use coconut oil?
No, there are studies from Harvard University that coconut oil is full of saturated fat. That one of the reasons we have noticed in Kerala, there is a higher incidence of heart attack and stroke compared to the rest of India. Because I believe people in Kerala eat much more coconut in various forms. So, as per Harvard study, it's not recommended.
But this slide is not covered.
Huh?
This slide is not covered. You can spend some
This you can go into Google and see what is the DAS diet, DAS diet. You'll find all this is available and freely in Google. Thank you.
Thank you, Dr. Barooah, for giving us very authentic information from, well, like you said, not sponsored by vested interests. Very impartial studies you have given us. It was like attending a professional seminar, made easy for the layman actually. Thank you very much. And as a small token of our appreciation, I will now request Dr. Shastri to just present a small token of our
slow.
We are also very happy to have Mrs. Barooah is also here. Mrs. Barooah is also here, so we would just like to ask her to just come on and request Srimati Kaveri Kumar to just hand over a small. Before we have actually a couple of announcements. So, next Thursday, as you all know, is the 14th Aradhana Mahotsav of Bhagavan Sri Sathya Sai Baba. That's on Thursday, 24th of April. So, we will have Suprabhata in the morning at 5:20, followed by outreach Narayan Seva from 10 to 11. And then in the evening program, we have Vedam chanting, Pallaki Utsavam, and special bhajans in the evening. We will share the timing details later. The second announcement is that the residential bhajan for the month of April will be held at the residence of Sri A. Krishnamurti. I think he is the person who stays closest to Sai Darshan. So anyway, we will share the address. And that will be from 5:45 p.m. to 7 p.m. And I request all devotees to attend the residential bhajan and receive Bhagwan's blessings. And the final announcement is that next Sunday, today is 20th, the next Sunday, 27th, we have a treat, that is, we have a music program presented by the Sri Tyagaraja Vidya Mandir team. So they are a group of ladies who present Ram Kirtanas, and they will also be, singing some Sai bhajans as well. So this will be on next Sunday from 6 p.m. to 7 p.m. Request all devotees to please attend this. All these are part of Bhagwan's centenary celebration. I request Dr. Barooah to please.
जय बोलो भगवान श्री सत्य साई बाबा जी की जय।